All right. Well, good afternoon, everyone. It is 1:02 is what I have on my watch. Kayla is on her way upstairs. Kayla Pearson is joining us as well. She just got stopped by a resident. So we'll just don't, please excuse her tardiness. She's usually on time. My name is Elise Piscitelli. I'm the health center administrator, and we have started these conversations with healthcare was the catchiest name we could come up with for our series. Here's Kayla. And so no worries. This series, we go opposite Dr. Stowe and Emily Hafner to try to talk about topics you would like to hear, anything that may be happening in the health center, and stuff that we can offer, different services we can offer to independent living. So as you know, all three of us primarily work out of the health center, and our primary focus day to day is the operations of the health center, which includes all the residents in assisted living, memory care, and long-term care. So I'm going to let these ladies just introduce themselves briefly for those that don't know, and then we'll kick off today's presentation, which is on ancillary services that apply to the independent living side and that we offer to all residents campus-wide.
All right. Good afternoon, everyone. My name is Erica Flowers, and I'm the Director of Nursing. I do feel like I grew up here at the Pines because I've been here over 19 years, and I oversee the health center and the wellness clinic.
Ayla Pearson, and I am the Admissions and Transitions Coordinator in the Health Center. I started as the social worker in the Health Center, and I have been here 4 years this month.
And I didn't share, but I've been here 2 years in July. So July 2023, I started as the director of nursing. And then in March 2024, became the health center administrator, at which time Erica transitioned into the director of nursing role. So we all work hand in hand, as well as working hand in hand with the independent living wellness team as well, Bill and his team. So today's session, we want to focus on ancillary services. This topic, it was in all transparency, when we redeveloped the health center tours, we were developing the presentation, the classroom presentation for those tours. And one of our last minute thoughts was, why don't we put in the different services we offer to the residents that we bring here on campus for our residents so that they don't have to go out. Well, we were pretty shocked that when we did the tours and we were starting to present the tours, that was the hottest slide out of all of the slides that we had in our presentation. And many folks were saying, oh, I didn't know we had that. I didn't know I could go use that service. And so we wanted to take a deep dive into what those services are, how do you sign up, who pays for it, and what it looks like for your experience with each individual service. So we do have a presentation here. We're not going to sit in front of the presentation. We're going to move over to the podium and present, but please feel free to stop us along the way if you have any questions about anything. Erica did point out that she oversees the wellness clinic as well. So the wellness clinic, as it is today, there's a nurse in there, Terry Murphy, who's an RN. She is a Pines employee. She's not an Atrium employee. She's a Pines employee, and she reports to Erica directly. The other staff that work out of the wellness clinic are Atrium employees, and they're senior care employees. I know there's been some chatter about the clinic and what that will look like. With Dr. Stowe coming on board as the medical director, we're still working out that plan for the clinic. So more to come on that. That may likely be a coffee and tea with Vernon and several meetings that he has, but we don't have any information to share on the future of the clinic today. But we just wanted to point out the nurse, when we get into what services the nurse can provide for you, Erica will share that with you, but you do not have to be signed up with senior care to go see the nurse in the clinic. Okay. So we'll kick it off. You ready?
Oh, I didn't move much of it. Okay, let's see if this works. Can you hear me? Can you hear me now? Okay, thank you. I do have a soft voice, so excuse that. So to begin the ancillary services, I wanted to start off with the wellness clinic. As Elise did mention, our wellness clinic nurse, her name is Terry Murphy, and she is employed here by the Pines. Our clinic hours are Monday through Friday from 8 a.m. to 4 p.m. and on Saturdays from 8 a.m. to 12 noon. We do have our wellness clinic phone numbers, which I do have listed there. The wellness clinic number is 704-896-1467 with a fax number of 704-896-0389. Walk-ins and appointments are available daily. And I did include the Atrium Senior Care Days, which consist of Mondays and Thursdays from 9 a.m. to 4 p.m. And the medical doctor with Atrium visits monthly on a Monday. I know Elise she just mentioned that you do not have to have senior care to utilize the wellness clinic. Anyone in independent living can utilize the services in the wellness clinic. Next, I have services provided without a physician's order. And these are services that the wellness clinic nurse can provide. So she can monitor vital signs as needed. If you need your blood pressure check, if you need your temperature check, she is able to do that without a physician's order. She can also do COVID and flu testing as well. She can she can do different wound care dressings, minor wounds such as skin tears, maybe abrasions or minor cuts. So she can handle those situations as well. She can also do a urinalysis. If you feel like you have a urinary tract infection or you're showing any type of symptoms of a urinary tract infections, she can do a urinalysis, which is able to test to see if your white blood cells are elevated, if you have blood in your urine, or if your nitrates are positive. There is a difference between having a urinalysis and a culture done as well. If you need a culture, you would have to have a physician's order for that. And with a culture, what they do is they take a sample of your urine and they send it out and test it to see which antibiotic will be resistant to the bacteria that's found in your urine. So with that test, a culture, you would have to have a physician's order. She can also apply and remove compression hoses. I know there are several residents who wear the compression hoses, and she can apply those for you as well. She can also assist you with senior care enrollment and also assist you with the select therapy or in-house therapy referrals as well. Next, I have a slide, and it's the services provided with a physician's order. The wellness clinic nurse is able to do blood draws. She can do finger sticks as far as checking your blood sugar and coumadin levels, which is your PT-INR. She can also do in-depth wound dressings or dressing changes that you have an order from a physician for. She can do vitamin B12 injections. She also can do allergy injections. She can collect urine samples. I know I just mentioned about the culture and sensitivity testing for urine. She can do those as well with a physician's order. She can remove sutures or staples with a physician's order, and she can also administer eye drops, pre and post eye drops administrations for any type of cataract surgeries. I'm sorry for the typo. And she can also remove a Foley calf, but she does not insert Foley calves at that time. All right. And that's all that I have, and I will let Kayla kind of step up. Oh, I'm sorry. Yes. Whenever it comes to services without the physician, there is no charge. She only charges for supplies as far as monitoring vital signs or maybe minor dressings. But whenever it comes to orders with a physician's order, she will bill it through your insurance.
Mm-hmm. I'll go around with the microphone.
Okay.
Yeah.
Yeah, Medicare Part B. Yes.
But if you take your own dressings, Van, there's no charge.
Yes.
If you take your own dressings, there's no charge.
And I would suggest you take your own dressings.
Thank you, Miss Margot.
How does a Novant physician get an order to you for a blood draw?
They actually can, if you have an order, you can give Terry your information to your doctor's office, and she can actually contact your doctor's office to get the order. They can fax it into her.
Typically, that's what we see most often is
Yeah.
a faxed order or a telephone order, and then they
Yes.
fax the paper order later on.
Erica, under the wellness clinic, you have listed once a month doctor visits. Is that just for Atrium Senior Care?
I have listed, are you speaking about the walk-ins and appointments?
Well, the second from the bottom, MD visits once monthly.
Yes, that is for senior care.
Thank you.
You're welcome.
Any other questions on those slides?
Okay. Let me step up.
Yes.
Just a point of clarification, everything that she's talked about, you do not have to be in senior care to participate in this. So you can, regardless of who your physician is, you can go to the second 2 pages here and they're available to you regardless. You do not have to be a member of senior care.
And you can have Novant or Atrium. It's your choice.
Getting my steps in. This is good.
Can these slides be made available to us?
Yes, they can. We're actually
Wonderful.
recording as well.
Yes, we can make those slides available. And we also wanted to point out, so in addition to everything you see that Terry can do up there, she can also, if you're just not feeling well, she can triage and assess under a nursing assessment. And so oftentimes what we see is she'll assess, and if she feels like you may need more diagnostic treatment or assessment, she will call the health center and speak with one of us to have you maybe come over for an observation stay, or she may recommend you go see your primary care if it's not something urgent. But she is one of those channels that you can go through to become admitted into the health center for a temporary stay if you may need.
Hi, everybody. I'm going to turn that off because I like to walk around. So we're going to start with our podiatry services with Health Drive. So Health Drive has been coming to the Pines for a few years now, and they see residents in the wellness clinic. So I put here kind of what the service was, when they come, how to schedule appointment, and how it's paid for. So starting with the podiatry services, they're on site once a month. They use one of the rooms in the wellness clinic to see the residents. Terry will schedule the appointments with you. It's about 15 to 20-minute slots for each resident. And the company will reach out to Terry and tell her what day they will be here, but they'll be here every month. Medicare will pay for your visits every 60 days. So usually every resident, if you are being seen, is seen every 60 days. So they'll bill Medicare or any supplement insurance that you have. And there's also a consent form that Terry has that you'll fill out and send it to Health Drive. She will fax it to them. So you have consented to services for them. And the physician that comes on site, her name is Dr. Gretchen Lawrence. So next is on-site dermatology, again, a longstanding provider here at the Pines. So they see residents in the wellness clinic with appointments as well. So if you had to maybe have something examined or something removed, they come on site and you can schedule that appointment with Terry. You'll go in and you'll fill out the consent form with her as well. They'll bill it straight to your Medicare or supplemental insurance, and they're on site the first Thursday of every month. So they're actually here today. And it's one provider that comes all of the time, and she is a nurse practitioner as well. So it's nice to have the consistency with the team.
And just to supplement what Kayla's sharing, with dermatology, they can do biopsies here on site. Any kind of advanced procedure, say a Mohs surgery that you may need to have, they can do more minor procedures, and they might recommend you go to the office for a more advanced procedure, but it's really individualized to what your needs are. But they certainly do biopsy on site, and then they're pretty quick with the turnaround time for results.
Yes, they'll do your yearly checkup for you too. So next is Access Dental Care. This is one of my favorite ones that comes to the Pines because they set up a whole dental office in our in-service room right outside of the wellness clinic. They'll bring the chairs, they bring the x-ray machine, they bring a dentist, a hygienist, assistant, and an office manager. So all of them come on site and they're able to see residents like you're at an actual dentist office. So this is also available to independent living residents. A lot of people didn't know that that service was, and not a ton of residents in independent living utilize it, but please know that you are welcome to. Same process there is going in to see Terry and saying you would like to utilize the dentist here. If you have dental insurance, it'll go through that or it'll be private pay. They will always send you a list of services that they've provided to you and an explanation of all the pricing as well. And that will come directly from Access Dental Care. And so they're a mobile dentistry company. They go to a lot of long-term care facilities all across the state. They come to us from Asheboro. And so they are here on site the second Thursday of every odd month of the year. So when you have a visit, it's scheduled through Terry. She'll tell you when your time is, and you'll come down to the in-service room, which is right off of the wellness clinic entrance, and they will see you there. And the consent form is the same as it would be for any other consent form. You'll fill that out and she'll fax it over to them. And so like I shared, they do x-rays, they do cleanings, if there's any major surgery that needs to be done, of course, they'll recommend that you go off site for that, but they can do a lot of it right here on site for you. So next is our audiology services through Charlotte Eye, Ear, Nose, and Throat. So Dr. McGrath is the one that comes out to the clinic and he sees residents right there in the clinic in one of the rooms that Terry has. And so they will bill your Medicare supplemental insurance as well. They are on site the first and third Tuesday of every month. So you also have to schedule those visits with the wellness clinic as well. You couldn't be a walk-in appointment. You'll schedule that with her, and then she'll tell you when your time slot will be, and you'll come and see them there. And then they have a consent form too that of course would be filled out. And so they can look at hearing aids, clean hearing aids, look in the ear, anything that would happen at a normal doctor's office for audiology can happen in the wellness clinic as well. So Vora Wound Physicians, Erica, I'll let you talk a little bit more in detail about Vora, just because they also come to the health center as well, but they are our wound physician provider here on site. And they are here one time a week, and it's usually on Tuesdays unless the schedule does need to change. And Erica, you want to share kind of exactly what he would do?
Yes, sure. So with Vora Wound Care, the physician that we use, his name is Christopher. His name is Christopher Bailey, and he does come on Tuesdays, and he also comes on Thursday as well. He does have like new technology that he uses if you have an in-depth wound, and he uses a ultrasonic mist that is a 2-day treatment. So the second day will not be of charge, and he does bill your Medicare Part B for his services as well. If you do need an appointment, you can schedule that with Terry as well. Okay. Yes, you would need an order for wound care as well. Okay.
And then Select, a lot of you came to the coffee and tea with Select Rehabilitation since they just started with us on July 1st, but this was just a brief overview of them. They're our therapy provider here on site at the Pines. Their office is located within the health center, right where the new health center entrance is. They're right off that. So if you were needing physical therapy, occupational therapy, or speech therapy services, you can utilize this service here instead of going off site. Or if you have another provider that comes on site, you can use them too. But for therapy, you'll get an order from your primary care provider and you'll give that to this therapy company, or you can give it to the wellness clinic. And then they will come out and do a screening with you and then start services as well. And they're here on a daily basis for us. And that is it of the big ancillary services. Any questions that you all have?
I just wanted, while Erica goes around with the microphone for the questions, I wanted to point out, these are the current services offered to independent living residents. We do plan to expand services as we also expand services in the health center. For instance, respiratory therapy coming on site would be wonderful to have. Mobile radiology we currently have in the health center. We don't offer that to independent living right now, only because we receive a window of a time frame basically of when they may come to do a chest x-ray on a resident. For independent living residents, it's not convenient for us to say, well, they can come between 10 and 4. So when they show up, we'll call you. We're at their mercy with mobile radiology. So we're exploring different companies for that to offer to you as well. But if there are services that you think of that you think would be very beneficial to have here rather than going off-site for, please let us know. Those are the top 2 kind of that we're working on right now.
Does Charlotte, ear, nose, and throat only do audiology here?
Yes, Marcos, they only do audiology services here at the Pines, nothing else, just audiology.
Every year, we have to take a Medicare wellness exam, and which means leaving here, going to our doctor, paying fees. Is there any chance that the Pines could set up that exam here maybe once a month?
Yes. So what Art is referring to is your annual wellness exam that Medicare covers for you. Your insurance covers through your primary care physician. And so our goal in the clinic is to have access to more accessibility to a primary care physician in the clinic that would do those wellness exams for you. We do recognize that once a month, having a physician once a month in the clinic, in the wellness clinic, has not offered the accessibility that you've needed. And within reason, we understand why. And so when we're looking at the future of the clinic, we are making sure that we have more accessibility to a physician.
It's been my understanding using podiatry that Medicare, I suppose, requires that you have seen your primary care physician within the previous 90 days. Is that the case?
Yes. So you have to have either seen your physician or they have had to sign off for you to go. Yes. So what the question is, to be able to see podiatry services, you would have to, he understands that from insurance coverage, you have to see your primary care physician within 90 days. They have to certify a reason for you to have podiatry services. So it may not always be a face-to-face visit with your doctor, as long as they sign that form. And most often what we see is there's a checklist of different diagnoses listed, and your physician will sign why they're referring to you, and insurance will cover it for that reason. Yes, Mr. Smith. Okay.
Physical therapy. I'm currently going through some physical therapy, and some of the equipment that are at the physical therapy location, I don't see in our gym, even though I think our gym is quite significant. Do those who provide the physical therapy bring more equipment in, or is there something over there I just haven't seen?
Yeah, great question. So the question is regarding the new physical therapy partner, Select Rehabilitation, where their office is located within the health center. They've got a little setup in the space that they're leasing from the Pines with some of their equipment in there, like leg weights or hand weights, and they've got different therapeutic bands in there. Their goal eventually, what's going to happen with all of the construction and the expansion, with the maintenance building being built, the old therapy room, for those that may remember, it's currently the facilities director's office. Becca, Chris Hinson, and Nick are in that room right now, right besides the pool. That will become the therapy room again once the new maintenance building is built. And then Select Rehab will be accessible right beside the gym, the wellness center. So they often will bring that equipment to the wellness center if they need anything, but they will bring in some equipment that is Select's equipment, but most everything they use we have here on site. Any other questions? Any services we have not covered that you would like to see here at the Pines? I think we spoke about counseling services in the tours, and we do have counseling services through, I always say, next chapter counseling. And so that is a counselor that can do visits with you in your accommodation and independent living, and they also see residents in the health center as well. And those visits are confidential. They do not share with staff what you've talked about in those sessions. They basically just share a roster of who they're seeing.
What about the COVID shots and RSV and all that?
Yes, great question. So vaccinations, I'll let Erica take that one.
So we are having, and I'm running to the front. So we will be having our vaccination clinic on September 26th from 10 a.m. to 3 p.m. We will have the newest formulation of the COVID vaccine 2025-2026, and we'll also have the high dose flu as well as the RSV. Now, if you had the RSV last year, you do not need it this year because per the CDC, it is effective for 2 years. Okay.
We didn't point this out, but with the wellness clinic, we shared about Terry being a Pines employee. And so you may or may not know that every resident of the Pines has a chart in the wellness clinic. Whether you see senior care or not, you have a chart, and that was established when you moved into the Pines. And so we really encourage, or we strongly encourage, that you keep that chart updated with your information, such as your primary care physician, your current medication listing, any specialists that you see. It's great for us to have that information. So in the event that maybe you do need us to help you with accessing those providers, we have it on record. We also ask that you keep your emergency contact list updated in the health center as well, so that if something happens, we know who to call and in what order to call them. So phone numbers may change, addresses may change. Just let us know so that we can keep that current. And you can also see Jan Parson or Emily Licavoli, our new social worker in independent living. She can help you with that as well.
Is there a sign up for the vaccination?
Yes, Rebecca Johnson will start accepting consent forms on September 15th. So she has the consent forms in her office as well. Yes. No, you do not. Mm-hmm.
We just ask for independent living, and Rebecca helps with this, that you have your most recent insurance card available so she can make sure that information, it gets processed through your Part D plan, any coverage for the vaccinations. Any other questions for us or topics that you would like to hear about in the future? We will present again in November, and we've talked about different things that we've accomplished this year in the health center, which may be of interest to some of you. And so if you'd like to hear that, or if you want to hear something else, we want to talk about what's going to be most beneficial to the residents in independent living. None of us like to talk. So anything you want to hear about, we will make sure we do a better job.
You may have done this, but at some point, could you review the process of transitioning from independent living to some other way of living at the Pines? And who makes that evaluation? What all is involved? Is it strictly up to the individual? I'm sure it's not. But sometimes the individual may not realize they need evaluation.
Yeah.
Could you go through all of that at some point?
Absolutely. That's a great topic. And it's transitions through care and what does that look like? How does that happen? So we can break down, we do a very surface level overview in our health center tours, but we can do a deep dive into what that looks like for a temporary transfer and then a permanent transfer as well. Great suggestion. Thank you. Anything else? Was this helpful for folks? Okay. All right. Well, thank you. And thank you to my amazing leaders up here. We've had a great team in the health center. I think I shared this at one of the coffee and teas. over the year in 2024, almost the entire health center leadership team turned over. And so it happened to be great turnover for the health center, and our satisfaction scores. We use the same We Care Connect survey that you receive in independent living. We do have an additional question, which is on the quality of care, because we are providing care in the health center. And so we have been well above the industry benchmark for all areas in the health center this entire year, and we hope to keep it that way. Yes.
Is it possible for you to discuss the transition issue right now? From independent living to?
Okay. Yeah, we can, I thought you meant there was a concern with transitions right now. So we can kind of give it an overview. I'll have Kayla kind of lead that of what it looks like for transitioning. We currently are utilizing our annex beds. For those that don't know, the health center license is 105 beds as the normal nursing home license. And that includes the Brown neighborhood, which is the original health center neighborhood, the Purcell neighborhood, which is the memory care neighborhood right off of the Brown neighborhood. Then we have the new healthcare side, which is Malden and Wilson. And then assisted living is part of that license as well. 30 beds in assisted living fall under those 105 beds. In addition to those 105, every 60 days, I work with North Carolina Department of Health and Human Services to license our annex beds, which we have 7 overflow beds directly off our new health center entrance. If you've ever had massage therapy, most often the massage therapy is occurring in that annex hallway in the health center. And so we recertify those beds every 60 days so that we have more beds available for temporary transfers. We typically don't use those annex rooms for a permanent transfer because it is more isolated from the original neighborhoods. But I'll have Kayla talk about the transfers and what that looks like.
So we'll go into a deep dive of it for the next presentation, what a permanent transfer and a temporary transfer would look like, but just surface level right now. And we can always talk about it one-on-one if you need to as well. If you had a surgery, like an upcoming surgery scheduled or a procedure, you could always come to the health center for that. And we would work together on that transition over when it was scheduled. If you had an emergency in your independent living accommodation and you just needed oversight in the health center, but didn't need an emergency room visit, you can also come to the health center for that. And I would work with you and your family and usually Terry in the wellness clinic on that transition. And then for permanent transfers, it's a much longer process that we go through for that. And I'll deep dive into that, but you always have an option to go to either assisted living, healthcare, memory care based on availability. But we like to have those discussions early on, even before a transition's going to happen, just so I can get to know you and your loved ones as well, so we can work through that transition.
We do have an admissions review committee here. That's myself, Kayla, Erica, Vernon, David Gentry, Gretchen, Emily Licavoli. There's a whole team of us. Dr. Stowe sits on that committee, and we meet every Tuesday at 9 o'clock, and we go over incoming residents that are moving into independent living or applying for independent living. We will be reviewing upcoming EA applicants for the early admission program or acceptance program. And then we also talk about health center transfers. So anyone that's in the health center temporarily or that may be coming permanently or staying with us permanently. And so we all talk as a group and review the residents. Bill, I forgot to mention Bill, but he also comes to that meeting as well. Any questions on that? But we will take a deep dive of what it looks like. What do you need to have? That is also why we encourage you to keep your medical record updated, because you can't plan in an emergency. So if you have it already updated, we already know what medications you're on. And if we have to go back to your residence to pull any medications, we also are making sure you don't have expired medications because we're not allowed to administer anything that is expired. And believe it or not, we've come across that, or medications not labeled or not in the original packaging. We cannot administer anything that's not properly labeled in the health center. Yes.
So along with your deep dive on transfer process, let's do a deep dive on what services are available in the health center, in assisted living, and mental health care, so people have a sense, even though you cover that on the tour, it would be helpful to have that as a presentation.
Great suggestion. Anything else? We thank y'all for spending the afternoon with us. It was right at almost 40 minutes. So we thank you. And any questions, you can always get a hold of us. Our contact information is on Pine Central, but our offices, ironically, are located in the annex hallway, all three of us. So we are located in the new health center, right off the new health center entrance.
Thank you.
Have a great day.